Thank you. Thank you for the kind introduction and the opportunity to speak. These are my disclosures, neither of which are relevant to this talk. When I first opened the title of this talk, I didn't read past the colon and was pretty sure that this was just supposed to be like an autobiography or a memoir. And if you're looking closely, that cup does say genetic perfection. It was bought for me by a former trainee, so I feel like it's okay, maybe, but it does a really good job keeping beverages cold, so I like it. But what we're actually talking about is making the education of trainees fun again. And as I sat down to really put this together, I had to think to myself, I'm not sure it was ever really all that fun, right? Residency is very hard. In fact, I've always described it as the best time in life I've never liked to do again. You give up a lot of your prime years of life. You miss a lot of life events, family events. You have limited earning capacity. Your sense of self can be destroyed. Many female trainees have significant fertility problems, and there are a lot of other issues. In fact, in preparing for this talk, I went back and looked at some pictures, and it's amazing that my children survived our residency because it looks like I was about to smother them. And in literally every picture, I'm asleep, except for the last one where I still look pretty rough and tired. So I think keeping that in mind as we interact with our trainees is hard. They're going through a hard time in life, and it's our job to not only support them through it, but to elevate them and keep them happy and well-adjusted through it. Unfortunately, recently, we tend to focus on the negative, right? We've been telling them for a long time that they're ill-prepared for practice when they're done, to the point where they feel ill-prepared for practice when they're done. And even the New York Times has said that we're sort of failing our trainees, and we're telling them that they're not living up to the expectations they should have. And I really think we need to shift that discussion and focus on the positive rather than the negative. So Daniel Pink wrote this book called Drive, which is really a book that focuses on motivation. And in it, he goes through 3 different types of motivation. So motivation 1.0 is your biology. You have to sleep when you're tired. You need to eat when you're hungry. It's how organisms and humans survive. Motivation 2.0 is sort of the classic carrots and sticks, that if you work in widgets and you're underperforming, if you disincentivize them or punish them, they should make more widgets. Or if you incentivize them to make more widgets by saying you're going to get paid more if you make more, that's motivation as well. It doesn't really apply to high complex fields like ours in surgery. And what really does is what he describes as motivation 3.0, which is self-determination theory. It's important to keep in mind that we are working with undeniably probably the most motivated group of individuals that you could ask for, right? Our trainees want to be better. They want to be surgeons. They want to be great at their job. And that motivation is deeply intrinsic, more so than extrinsic, right? They look for a sense of purpose. They explore everything with curiosity and internal motivation. And I think that we can feed that internal motivation by focusing on this self-determination theory. So self-determination theory states that humans have 3 basic needs. We strive for competence or mastery of whatever we're trying to do. We want some autonomy so that we can make decisions or learn things or explore our own interests on our own. And then we want to feel related to our field as a whole and the people that we're working with. And I've sort of tended to approach my interactions with trainees with a focus on these 3 aspects of their professional and personal development. So to me, the competency and mastery comes through both deliberate practice, a growth mindset, and us providing appropriate feedback. Deliberate practice is the gold standard of performance improvement. It's basically working with a coach or a mentor, for us, the faculty surgeons, when they are the trainees, to identify the weaknesses in their skill set and specifically and intentionally practice and focus on those. Right? If you practice what you're good at, your performance doesn't really improve, it just plateaus. If you find your weaknesses and focus on those, you get overall better at whatever you're trying to do. And so I think when we're working with trainees, I think if you keep a focus on the areas where they're struggling and make that what you work on with them going forward, they will get overall better and better. It's important to do that with an idea of focusing on a growth mindset. So the 2 mindsets are different frameworks of thinking that help you to experience the world. People with a fixed mindset believe that they were born with a fixed set of skills, knowledge, and abilities, and they can't really change those. That's sort of like the deck of cards they were dealt at birth, and they never really change. People like that tend to avoid challenges and avoid feedback because it's a critique of them intrinsically. Versus people who have a growth mindset that believe that their knowledge, their skills, and their abilities can get better through learning. And so when we give feedback or interact with our trainees, we want to push them much more towards a growth mindset than a fixed mindset. And you can do that through how you give them feedback. So if you look at the list on the left, saying you're a natural, I love that, or well, at least you tried, or great job, you're talented, that's citing sort of like an intrinsic ability of them and applauding it. Instead, applaud their effort. So you can say, that didn't work. Let's talk about how you approached it and what might work better. Or, this is hard. Don't feel bad if you can't do it yet. If you work more on this or that, you probably will be able to, right? So when we interact with our trainees, and especially when we debrief with them, keeping a focus on a growth mindset and the way that we talk to them, I think is very beneficial for their professional and personal development and their overall satisfaction with their training. The EPAs, I think, are particularly helpful with this regard. In every EPA that you complete, you have an opportunity to provide some narrative feedback, and that narrative feedback should focus on something that they didn't necessarily do well, but an area that they can work on in practice and improve upon for the next case so that they continue to get better and better over the course of their residency. In terms of the autonomy in the operating room, so similar to the BID model that Dr. Jackson brought up earlier, I like the SAGE's train the trainers model. In that model, there's a set, a dialogue, and a closure, and those really are sort of the briefing, the intraoperative teaching, and the debriefing at the end. But in the set, the trainee sets the learning agenda. So when I start a case, I'll ask my fellow or my resident, what do you want to get out of this case? This may be our 100th inguinal hernia that we're doing together, but what specific thing do you want to focus on in this operation so that you can set the learning agenda by your needs, and we can really slow down and focus on that portion of the case. When you're in the operating room, the most powerful word I find in the operating room is stop. Stop what you're doing, and let's talk about what you're seeing, what your plan is, and let's move forward. I think very frequently we tend to try and teach while people are operating and working, and it's really hard for them to have any cognitive ability to take in what you're teaching because their focus is on the operation. If instead you stop them and pause, their focus is now on the conversation that you're having, and the learning for them can be much more effective. And then during the closure, just point blank ask them how you think it went, right? And what can you do better next time? And then give them some feedback. I tend to keep the feedback usually positive. I start with focusing on the things that I saw them do very well, but then also try to provide them something that they didn't do as well now, but they can work on and improve later. And again, that gives them that sense of growth and movement towards competency and mastery. And then to relatedness, this is one of my favorite quotes, and this is how I tend to try and live my life in all my interpersonal interactions with people, both in the hospital and outside. So Maya Angelou said, people will forget what you said, they'll forget what you did, but they'll never forget how you made them feel. And that sense of relatedness and purpose and being part of a family is what really brings a lot of joy to people. So my best example of this is at my current job. So at Duke, this is the tunnel that takes you from the parking garage to the hospital. I don't know why we need a tunnel. North Carolina has pretty nice weather, right? When it rains, maybe it's okay, but most of the days you want to walk outside. So on the way into work, I don't tend to take this all this much, and that's because it's a pretty barren and empty tunnel. The walls are empty with the exception of these seemingly preposterous pictures that show you where you are in the tunnel. That are really highly unnecessary because there's one entrance and one exit. Like, I don't know why these are there, but I laugh at them every time I walk past. At the end of the tunnel, there is a security guard station, and most of the time in the morning, or a lot of times, there's a security guard sitting there, or sometimes it's left unstaffed. But in the afternoon, everyone that I know walks out through the tunnel, and they walk out because of Ronell Kitchings. Ronell was a native of Durham. He served in the Army for 20 years, and this is what he does all day when he is at work. Can we make the volume play at all? I'll try and go. He stops everyone. He looks them in the eye. He thanks you for what you did in work. When I come out wearing a white coat, or if he knows you're a physician, he'll give you a fist pump and say, "Doctor, thank you for taking care of the patients." He thanks all the nurses, and everyone walks out through the tunnel so that they have that experience at the end of their day to go home feeling better. I always experience that in the operating room with a mentor from residency named Selwyn Rogers. Dr. Rogers is now the chief of trauma and critical care at the University of Chicago. He would end every case by looking you in the eye, thanking you and the rest of the team, and shaking your hand. And that's been something that I've adopted into my practice. Most of the time I try to remember to do it. This was obviously a setup and staged one so that I could have a picture for the talk. But I really do think it helps with feeling inclusive and feeling that the trainees are really a part of the team and are there to take care for the patients. And lastly, invite them into your lives, right? Show them what life is like on the other side. Have fun in the operating room, but also show them that you have fun at home. We try to have family dinners and have the residents or fellows over so that they can see what life is like when you're a faculty, how you interact with your family, and that life is really, really good in surgery and outside of surgery. So these are just my sort of ways of going about work. And I think focusing on the positive and continuing to elevate people at work is usually the thing that I think makes it the most fun. So thank you.